What are your thoughts about early Botox, or do you think that's premature?
I would say if you don't have wrinkles, don't start. Just wait till you're starting to see static lines at rest. Then you know where your muscles tend to contract too much, and sometimes we're starting earlier for certain conditions like.
Are you using these nucleotides and peptides as microneedling, or have you found success with actually injecting them? What are your thoughts on actually using them for filler purposes?
Such a good question, Nicole, because it's fully off-label and illegal in the U.S. to inject nucleotides because they're not FDA approved for use for any medical claims or as an injectable. People that are doing it are really kind of crossing the line, and also there's not a lot of scientific research that's published that shows it's not going to cause problems later. Does it help and can it be beneficial? I'm sure it is helping some people, and there have been some good before and afters published, but they're not showing you the problems. We've seen now a lot of case reports of people that have.
What are your thoughts on this trend of facelifts in the 40s?
Frankly, I'm not here for it. The best age for facelift is around.
Welcome back, everyone, to another episode of Scrubs and Stilettos with me, Dr. Nicole Martin.
And me, Dr. Tiffany Moon.
Tiff, I don't know about you, but I feel like everywhere I look nowadays, or maybe it's just my social media, I have a post about someone doing plastic surgery or this celebrity's new look. And so I thought it would be a great idea if we brought a world-renowned plastic surgeon to the show to discuss all the things that we're seeing on social media, Botox, filler, facelift in your 40s, answer all these questions that I don't know about you, but I have a ton.
Me too. So we brought on the best of the best. Her name is Dr. K. You have probably seen her on TikTok or Instagram because she's always sharing her knowledge. And I just think she is going to be a wealth of information for us.
Before we dive in, let's share our weekly obsessions. Do you have anything for us, Tiff?
Oh yeah, I was going to show you this bag. So this is from a brand called, I don't know if I'm saying it right. It's like Le Parmentier. I don't know. You know, I can't pronounce it.
Yeah, Le Parmentier.
But this bag, you know, I like the Birkin because it's like an open tote. Like, I don't like bags that don't sit on their own, like a Neverfull or a Goyard tote. When you put it on the floor, it just flops. Yeah, so it sits upright. And I got this beautiful tan color. It's called the Jackie bag. It's made in Italy. Okay, girl, guess how much this bag was?
I don't know. It looks like really nice leather. A couple $100.
It was $340,
okay.
Which I
That's
feel
on the
like
lower side. I thought it was going to be closer to $1,000, like $800-900.
And it is so cute. It has this like divider thing on the inside. This is like my new favorite purse.
Does your laptop fit in there?
No, my laptop doesn't. But like when when I'm not working, I use this bag, and then I don't like freak out because sometimes like a waiter will be like refilling my water at a table, and it's like a real Birkin or a Croc Birkin, and I'm kind of like freaking out. But with this, I feel like I can just like, you know, la 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 la.
Yeah. You can just enjoy it. I've recently started to reconsider bags. Remember we talked about the pochette? I have this like light color cream pochette that I've yet to wear because I'm like, it doesn't have feet. If I put it anywhere, it's going to get dirty, and it's cream and it's Swift and it's this. I'm like, why did I buy this bag? It hasn't left my closet because I'm scared to wear it because I don't want to mess it up. So like, what was the purpose of buying it? It's so stupid.
Because it's so pretty.
I know, but you know, sometimes practical beats pretty sometimes.
You know, being that we're now in our 40s, I am now starting to dress for function over fashion. Like I was going out the other day, like out, to a dinner party, and I wore flats. And my friend was like, "Are you okay? Like, who are you?" And I was like, I don't know what's happening to me.
You know, I think we're just getting to the age, and I'm actually not mad at it. I'm very happy to this is what it is, and this is how I feel today, and so be it. All right, so my weekly obsession, I thought it would be appropriate to do something skin related since we're going to be talking about skincare and, you know, surgery and all of these things. It bothers me so much when I wash my face in the shower. And I think I do a really good job of like getting on my makeup, and then I get out of the shower and I grab my white towel and I go like this, and there's still like gunk of makeup. Even after a double wash with the oil based and the water based, there's still makeup. So I bought this the other day at my like med spa that I go to. There's a glare here, so I don't know if you can see it. It's called Lumiel Glass Skin Liquid Exfoliant. And you're just supposed to pump a couple squirts of it onto a cotton pad and then exfoliate your face with the cotton pad and the solution. It has salicylic acid and a couple of like glycolic acids. So it's supposed to exfoliate your skin, but it also does a great job of getting off all that like little residue of makeup and stuff. So this is the first step when I get out of the shower. I do this with a cotton pad and then I apply my toners and my serums and my creams and all that stuff. But I'm
So
actually
you do it every day?
I do this every day, yeah.
Oh, so it's a gentle exfoliant. It's not like
super gentle. It's meant for every day, kind of just to get like those dead skin cells and that like little residue of makeup that sometimes lingers. And it's super gentle because I have sensitive skin. I can't even use retinol. And I just feel like it keeps that like glow happening. And I don't think this was expensive. This was under $100.
I mean, you look glowing.
For skincare, it's not.
It's relative,
It's
right?
expensive. I'm not going to say it's not expensive, but compared to some
It's worth it.
products, and this has, I mean, I bought this a couple months ago and I still feel like there's like half a bottle. So it lasts also.
Amazing. Awesome.
Well, let's welcome our guest, Dr. K. Like Tiffany said, she has a huge social media following, but she is an internationally renowned facial plastic surgeon, but she's also a head and neck surgeon, so double board certified. She has an office in Pasadena, California, but she's known across the country as one of the top facial plastic surgeons. She trained at UCLA and she is board certified in the Academy of Plastic Surgery as well as otolaryngology, which is the ENT boards. So let's welcome Dr. K to the show. Welcome, Dr. K, to the show. We are so excited to have you on. I'm actually very excited to have you on because I recently had lunch with a couple of my girlfriends. You know, we're all very much into beauty and skincare and all of us do our regular Botox. One of my girlfriends was like, guys, that's it. I am no longer doing any fillers. I'm not doing any Botox. I am detoxing my face because I'm getting ready for a facelift at the end of the year. And she is 40. She's turning 45. And I was like, wow, that's young for a facelift. I was like, you usually think of facelifts in women when they're in their later 50s, 60s. And then she said, no. Young facelifts in the 40s are all the rage. And as an expert in the field, board certified plastic surgeon and ENT, what are your thoughts on this trend of facelifts in the 40s?
I am so glad you're asking because I think this has been the summer of resurgence for the facelift and younger people getting procedures done. And frankly, I'm not here for it. I think that you have really a distinct time in your life when you need to be thinking of facelift. And for most women, and in fact, it's been studied and published, that the best age for facelift is around 55 to 60. And there's a couple reasons for that. The first reason is you really only have 2 good facelifts in your life. It is really difficult to see someone in their third facelift have a natural and beautiful result just because of the tightening, the smash lifting, the muscle atrophy that happens as you age. The third facelift looks very like 80s Joan Rivers. It's hard to find a good third facelift. And the second thing is a facelift gives you about 10 years of results. So if you think when you're 55, that gives you your next one around 65, 70. And then do you really want to do another one when you're 80? Like, no, you're going to need to space those out at those kind of intervals. So I think the girls who start early in their late 30s and early 40s thinking they're doing something preventative are sadly mistaken. And they're going to be somewhat disappointed. Like everything looks good in the first 6 to 12 months after facelift. You feel tighter, everything's slightly swollen, it's got new blood flow and perfusion. But once that swelling goes down, people are back in our chairs for regular mid-face maintenance with tox, with fillers are still necessary. So sometimes there's some disappointment because the mindset is that maybe if I do a facelift, I won't need to do regular maintenance. And that's just not the case at all.
Wow, I did not know that. I'm going to have to invite you to our next girls' luncheon, Dr. K. Some damage control.
I mean, what does this person look like? Like, does she look like you? And
I mean, yeah, I think I would not have looked at her and been like, man, this girl needs a facelift. Like, I think we all, as we age, start noticing subtle differences. I've always been a very round, full face person. And do I notice that my cheeks have started to fall a little bit? Do I have a little of this kind of like, drop here? Sure. But it doesn't mean I'm going to go sign up for a facelift tomorrow. Like, I just think it's what it is.
I mean, you look fabulous. I don't think anybody would sign you up for a facelift, hopefully. But this is not always an ethical industry. And I think there are many surgeons who are ready to operate on a 40-year-old woman and 45-year-old, like, yeah, let's do early surgery. Like, they're not telling you the whole story about this procedure is going to last a good 10 years if you take great care of it. Like, and also that, like, are you really going to want to do like the third facelift when you're, it's a lot of surgery at a young age. You need to have a skin laxity. Like if you can pinch a centimeter of excess skin, and a centimeter is like about a fingernail's width, then you're ready for surgery. There is skin that needs a tighten and a trim. But if you can't, then there's many other things we can do. And I'm a huge fan of the collagen stimulators. Why not grow natural, beautiful collagen and improve the thickness and padding of your skin before just deciding to be under the knife?
Okay, that's a good point. Explain to our listeners what a collagen stimulator is, maybe some of the names they might have heard, because people might not know what that is.
So a collagen biostimulator is a product that once it's injected, it's an injectable. So maybe you've heard names like Radius and Sculptra. And these are the two most popular ones. Other collagen stimulators would be like fat substitute, like Renuva. And these are things that when your body sees them injected, it triggers a collagen growth response. So it's a natural way to grow your own collagen. And the fascinating thing is when you grow a new molecule of collagen, it lasts up to 10 years. It has a 10-year half-life. So it's your new foundation that's going to maintain and keep you kind of taut, toned, and firm, and better skin quality.
Amazing. Okay.
Dr. K, you mentioned some of the biostimulators like Sculptra that can be injected to stimulate your collagen. If someone doesn't want to do an injectable but is looking at other ways to stimulate collagen, things like microneedling that cause microtrauma or some of the microneedling with radiofrequency like Morpheus, what are your thoughts on those techniques to stimulate collagen?
I am a huge fan of microneedling, and I think I do it quarterly, and all of us should. I think it's a great way to reset your skin after summer sun damage or like finishing a dry, dehydrated winter. It is like the number one way to make sure that your skin's quality, like pore size, fine lines, pigment, redness, that they stay improved and even. And it just is 400% more collagen production when you do 4 sessions of microneedling. So I think you can count on it to give you skin quality glow. And I love the new molecular science that's coming into aesthetics as we're using products like exosomes and polynucleotides and growth factors that once you create these little microneedle openings, they infuse into the dermis of the skin and get you a lot of fibroblast stimulation. It's like literally longevity therapies for skin.
What would be the protocol? You said 4, but is that like 6 to 8 weeks apart? Or could we do like 3 to 4 months apart? Like what would be the proper protocol?
My favorite is to do them about 6 to 8 weeks apart. I think that gives plenty of time for cellular repair. I think one thing that we're guilty of is sometimes overdoing aesthetic treatments. Like if you try to do these every 3 weeks or every month and you think you're going to get even better results, you're not, because your skin fibroblasts do get exhaustion. There's such a thing as overstimulating the skin. Like too much retin-A makes you red, dry, irritated. Too much laser, too much microneedling. You must give time for repair. It's like exercise and then rest. Cells need that too.
And between like your own PRP versus exosomes, do you have a preference for which one?
100%. So PRP or platelet-rich plasma, now there is a much stronger version of that that's made by a company called Ariessence. They have a platelet-derived growth factor, and it's human recombinant technology, but it concentrates what's good out of PRP up to 200,000 times more potent. So when people come into my office and they're getting a PRP treatment, unless I pre-checked their blood work to see like how many platelets do you actually have? And do you have enough to make good, rich PRP, or is it going to be a really weak, not a really good, rich source of growth factors? So you don't know that unless you've really checked those patients, and then you check their blood draw and run it through a cell counter, and really no one's doing that in aesthetics. So like you're getting maybe watered down stuff. It's better than saline. It's better than nothing. But now we have these really potent growth factors that we can use as a substitute for PRP. So that I think is excellent to do. And then even stronger.
So I can take
What's the name of that? It's called
What's the name of
Ariessence. It's called Ariessence, and it gets microneedled into the skin surface.
Ariessence.
Yeah, really cool, very high-tech product. And then Love X is I'm also loving salmon sperm. Of course, we got to talk about salmon sperm.
Yes.
And
we just talk about it now.
Yeah. So that's so interesting and funny. Like Kim K coined it as salmon sperm, but honestly, it's a DNA repair facial treatment. Like we're using polynucleotides. Yes, it comes from the sperm of a salmon. Because why a sperm? Because if you look at salmon roe, which are the salmon eggs, they're giant, right? It's not like baby caviar. They're giant cells, and they have a giant nucleus. And in that nucleus, there's DNA. And so that cell is all nucleus and a lot of DNA. It's easy to harvest. So we're spinning that down. We're ultra purifying what we get from the salmon sperm. And those are the nucleotides. If you remember 7th grade biology, it's CGAT that makes up the DNA chain, right? And so that's what we're needling into the skin surface is the CGAT, the nucleotides. When your skin has brown spots, fine lines, wrinkles, or sun damage, it's DNA damage that happened that caused all these problems. So we're giving those cells all the building blocks. You don't have to manufacture your own tired skin cells. You need to, here it is. It's a direct infusion. Take these building blocks and repair. And so the skin, as a result, gets this really beautiful glow, accelerated repair. You can treat, that's why it treats scarring, fine lines, brown spots really well. Good for hair growth. So those are, you might have heard of PDRN, PDN, PN, polynucleotides, salmon sperm.
Are you using these nucleotides and peptides as microneedling, or have you found success with actually injecting them? Because I was seeing somewhere, not on your social media, but on Instagram, of people that were getting their under eyes filled with these, peptides and nucleotides. What are your thoughts on actually using them for filler purposes?
Such a good question, Nicole. I love that you're asking that because it's fully off-label and illegal in the U.S. to inject nucleotides because they're not FDA approved for use for any medical claims or as an injectable. So people that are doing it are really kind of crossing a line, and also there's not a lot of scientific research that's published that shows it's not going to cause problems later. In Korea and other parts of the world, people have been injecting this for more than 10 years. But if you look at their studies also, their studies are not the most scientifically sound. They're case reports, they're small studies. They don't have placebo control. So it's not real science at this point. Does it help and can it be beneficial? I'm sure it is helping some people. And there have been some good before and afters published, but they're not showing you the problems that we see. We've seen now a lot of case reports of people that have little bumps, polka dots that persist, and they're like granulomas, which are inflammatory nodules that can be very hard to get rid of. And so I think that's a little bit playing with fire, and you're much safer just doing the microneedling approach.
You've done a really amazing job of building your practice, building your social media, and social media is amazing in the sense that it exposes you to so much information. But like I just mentioned, there's also a lot of misinformation, especially I think when it comes to aesthetics and plastic surgery and certain types of procedures and whatnot. How are you navigating? I'm sure you get all sorts of weird requests from patients and coming with things that they saw on social media.
Yeah.
Have you noticed an increase in strange requests or things that maybe you don't necessarily agree with because of social media?
All the time, but when I sit down and explain it to people, the reasons why maybe that's not the best idea, always they'll take my advice for it. And if a request is too weird, I just don't do it. It's just not for me. I'll refer them to a friend or someone who's doing strange off-label things. But it's funny how trends develop and then everyone wants to do them. And they're not even really thinking or asking the right questions. Is it safe? Is it proven? Does it have results that are, scientifically sound? Or is it not going to give me side effects or problems in the future? That's really important. And if you jump on a bandwagon of beauty, I think you have to also worry about, like, what's your global look going to be like in 10 years if every 6 months you're popping this trend on your face and then this trend on your face and that trend. You're going to have like a Picasso face that does not have harmony and aesthetics, right? It's like isolated features that I decided to stick on because they were trending. It's like maybe not part of what my aesthetic and optimized face should look like.
We have so many young women now who are starting neurotoxins earlier and earlier, some even in the early 20s.
Yeah.
What are your thoughts about early Botox? Someone says, oh, it's preemptive. I'm making sure I don't have wrinkles before I even get them. Or do you think that's premature?
I started Botox very young, like 27, I think. And I would say if you don't have wrinkles, don't start. Just wait till you're starting to see, static lines at rest. So you're starting to see little etchings. Then you know where your muscles tend to contract too much. And skin is like a piece of paper. If you repeatedly fold it, it's going to keep those creases. You can't iron it out. Like we all have a tablecloth where we can't get the crease out. It's just part of it. So yeah, it is preventative. And start when you see those etched lines. And sometimes we're starting earlier for certain conditions like rosacea. We do microneedling when we put toxin into the needling, like a glow tox or a microtox effect, because it shrinks redness. It's good for pore size. Really, like you can do full face microneedling with tox for that skin quality improvement. So I think that's a case where you could start a little earlier. And then mostly I say wait till you're like, late 20s, early 30s when you're seeing those etched lines. But yeah, I think this forehead right here is pretty smooth. Never got the lines because I started so young. And so I think there's a lot of benefit to that. Like, why have to wait till you have a problem to fix? How old were you guys? Wait, how old were you guys when you did your first?
Oh, I was probably like early 30s.
Yeah, same. Early 30s.
I mean, I don't think I did it very late. If anything, I probably did it earlier rather than later, but I would say probably early 30s.
Yeah, that's about right, I think. And but I am seeing 22-year-olds, 25-year-olds.
Really?
Yeah, 21-year-old yesterday I saw, 21-year-old. And a lot of my staff really sees the benefit. And some people are doing it for migraines too. I think that's an awesome thing to remind people that it's a lot of women, young women, have chronic severe migraines and they're taking all kinds of pills, sprays, and drugs. And like Botox is 95% effective. You'll get it like 2 or 3 times a year and never have a migraine again.
Amazing. Is it like, where exactly are you guys injecting it for migraine benefits? Is it like the traps, the neck, does it tension headaches? Like how exactly is the Botox flip?
It depends on your symptomatology, but for the most part, it's the forehead glabella and into the temples and in here. But there are the ladies who clench and grind, and the masseter Botox helps a lot with those tension headaches. So we'll do temporals and masseter. And yeah, some people do get a lot of neck tension and like in the back of the neck. I think everyone on their computer all day long for 8 hours a day. Yeah, like a little shrimp. So I do trap tox and occipital neck tox for those kind of tension necks.
I am a teeth grinder, so I have really strong masseters, and I do get, like TMJ from it. I did do lower face tox once, and oh my goodness, Dr. K, when I tell you that my smile was so warped afterwards, they must have hit like a branch of some thing that moved. My smile was lopsided. It looked like I had a stroke.
Oh.
Never again.
Oh my God. No, don't blame the tox. That was the injector who placed it wrong. Like it got too close to a muscle. That's a known problem when your technique is off a little. So
it was terrible. And this is like somebody who had done my normal tox for a very long time. But this lower face tox did not work out so well for me.
That's where it helps to see a surgeon because we know the anatomy under the skin very well. But it's a great treatment for people who clench and grind. It's life-changing. It resolves that TMJ so well. I would just remind people don't overdo it because the more you shrink these masseters, the more you feel jowly. Like this, you lose the big bolsters of support, and then things gel forward. So I'd say be conservative with that.
That makes sense.
Interesting. Give us your thoughts on filler. I mean, this is so much. Is under eye filler okay? What about temple filler? What's with all these people that look overfilled and crazy? I'm not going to say any names, but one of her associates, previous associates, was recently in the news for something. And I just feel like people sometimes take it too far for filler. So give us your spiel on filler.
Okay, so number one, filler is an excellent and wonderful tool. And when we use hyaluronic acid fillers, we're using them as a substitute for facial fat, wherever you have thinning and deflation and aging changes, because fat changes over time. This is what happens as you get to be 50, 60, 70, and even starts as early as in your 30s, right? So it's not to be villainized. The people that have got filler face have had bad injectors. My clients and people who have great filler work, it's undetectable beauty. And it's like a really precise way of replacing facial volume as you age. Like it's a big deal to harvest fat and do fat transfer and does all the fat grow roots and take or not? It may not, but filler is extremely reliable. And when it's properly placed in a deep plane, it doesn't show itself on the surface. So I think all that, it's sad that we had this progression of like overfilled faces, like seeing Madonna on an award show and then seeing this. There was another friend of mine, a lady who in England showed her facial MRI where she had 20 years of filler in her face. And actually, I know her in person. Her face looks great and she's had it expertly placed. So like, I thought it was a beautiful, like, that's nice. 20 years of maintenance and you look great on the outside. But all those things kind of added up to this filler fear, where people sort of like were pushed away from doing filler, dissolved all their filler, and went the opposite direction. And like filler got very vilified. And even right now, people are like, oh, I don't want filler. But on the other hand, they're also like, oh, I don't want sculpture. I don't want radius because I want to get a facelift. So we're like, okay, what do you want to do?
I have to say that that's kind of where I am right now. I must be the most annoying person. I'm that person that walks in and I'm like, but I don't want filler, but I don't want this. But I want you to make me look younger, but like wave a magic wand and just fix it. But I don't know how.
Yeah. So that's fortunately we have now these new skin quality treatments like the microneedling with all the polynucleotides and exomes. I think that's going to like tide people over to like softening their filler effect. I do think like post pandemic, we all overdid it a little bit on the filler. And I don't know, it was some psychology of pandemic that pushed us to like do more because we saw our Zoom faces so much and we were like just letting ourselves go a lot. And everybody got out of the pandemic and did so much filler. And now we're switching to, I've always done a ton of biostimulators, but I'm having everybody do collagen stimulation. And it's always on the outside of the face, pulls things up, back, and lateral. So to your other questions, I love temple filler. That's like the fountain of youth for the face. No matter how often I place it in any age group I place it in, it always looks stunning. It gives that rounded, full, like Bella Hadid lift. So great. And I love under eye filler. Everyone who says don't do under eye filler and just go do a bluff, like I love doing a bluff too. I do a beautiful bluff. But there's a really important role for under eye filler. And I can also treat your under eye with fat, nano fat. We can treat it with polynucleotides, multiple different things, PRP. But I'm honestly not such a big fan of PRP under the eyes. It takes like 5 sessions. The results are nearly invisible. It's so subtle and gradual. And it's like, who really wants to have their under eye instrumented 5 times with bruising and swelling? It's not precise. It's not like fast. It's not under eye filler. 1 session, half a syringe on each side. I can get you looking rested, refreshed, and brighter. That's easy. Until you're ready for surgery, that's what we do. And if it lasts about 2 years, it's a really good treatment.
Since we're picking your brain, Dr. K, on different modalities or treatments, what are your thoughts on the PDO threads?
Oh my gosh.
They terrify me. Like just watching a video of someone having something tunneled subcutaneously and blindly pulling it up. I'm like, oh my God, what if they hit your facial nerve? They make me very nervous, but people seem to like them.
It's such a temporary thing. So I say only ever think of a thread if you don't mind. They're only going to last 6 to 8 months. Mostly it's the beautiful swell that gives the result more than anything. And it's a little tiny bit of a Velcro effect. Like you like what you look like, but you want a little slight smudge. That's only going to last 6 months. And you need to have a really expert person doing it because they are tunneling through multiple layers. And as a surgeon, I just don't see the value of placing a thread that doesn't have a knot tied. Like you're not tying a knot and anchoring it anywhere. So you know how we sleep so heavy, and at least I do. I'm like smushing my face, and those forces on the threads like immediately disrupt them. They're not maintained. You look good while it's swollen. So I'm not a super fan. I would say there's a role for women who've got good volume everywhere and they want a little zhuzh and a little tightening. We can try it. But honestly, I can put way much more Sculptra or collagen stimulator and much more precise, less painful, faster. There's better ways to grow collagen.
You have the experience on being both sides of the office door, doing the injectables, seeing patients for outpatient procedures, but also being in the OR doing the surgical procedures that eventually follow. Do you find that patients who have had threads or chronic filler use, that their surgeries, if they choose to have a facelift eventually, are more challenging? Do they have more scar tissue, or does that create some intra-op issues?
Such a good question, because that is a big question that patients have. And a bunch of surgeons this past year went on their platforms and said, oh, don't ever do collagen stimulator. Don't do Sculptra. Don't do Radius if you're planning to have a facelift. And I think it's absolutely an exaggeration, because if you see a great injector and they've injected the proper planes of the face, you're going to have like nice, thick, padded skin to go into surgery with. Obviously, I don't recommend any treatment 6 months prior to surgery. We will leave that face alone and let things all settle down. So when we go into surgery, hopefully the dissection planes are easier. And it all depends on who your injector was. If they don't know what they're doing and they're injecting into your SMAS or other areas, then it's a bit harder dissection. It is. But like for my patients, I know the plane. I know where I need to place these products. When we go into surgery, it's not that much different. It's not virgin skin, but no one in our generation has virgin skin anymore. Literally no one. Like everything we do, microneedling, radiofrequency, toxins, it's all going to cause some minor architectural change in the skin. You have to see a surgeon who's comfortable with that and doesn't want, I only operate on virgin skin. Oh my God, who does that? We have to operate on people with skin cancer, or people who've had car accidents, people who've had lots of different, trauma, cuts. You have to be able to navigate that terrain and the landscape of a face that's lived.
What do you think is your favorite surgical procedure to perform?
Oh my gosh, I love bluffs, upper eyelid bluff, lower eyelid, and rhinoplasty. Those are my two favorite. And the third would be like a mini lift, because I think that's so discreet and done at the right time. It can give just that little extra enhancement to where people don't feel the need to rush to bigger surgeries fast.
Okay, explain the mini lift a little bit more. How is that different from the full facelift?
So mini lift is going to be similar incision to a full facelift. It runs in front of the ear and slightly behind the lobule of the ear. And it's for the person who is probably late 40s, getting to be 50, and feels a little laxity. They feel a little early jowling, so they're seeing the lower face changes, but the upper face, the mid face look good. So if you just need that little lower face tightening of a centimeter or so, we can do a nice skin excision here, and that's kind of old school skin excision. It's not necessary to to always do a deep plane lift. Deep plane facelifts are trending right now, and they're great for the 55, 60-year-old woman who has plenty of laxity and neck issues. But if your neck looks fairly good and you just have a little jowling, you're a candidate for a little mini lift.
Do you feel like bluffs have become very trendy in the last few years? I feel like I didn't hear anybody talking about bluffs 5 years ago. And in the last 2 years, I know 6 girls that have had bluffs in our social circle, and they're all in their early to mid 40s. It's the new thing.
And I think that's a great thing. The bluff is a procedure that I would do younger rather than wait till you're heavier and more hooded and your eyes look really tired. Because sometimes people are with the mindset I'll just wait till I'm older. But this is something that a 1 hour simple skin excision, 1 week of downtime can just give you you look 10 years younger, literally. I feel like it's the Lindsay Lohan effect of like, what did she do? She looks so fabulous. And like, she looks more gorgeous because to me, it feels like there's a little skin excision that's happened there, but allegedly. But I think so. This has been the summer of blephs in our practice too. And it's been really fun and beautiful transformation. You look 10 years younger with this simple procedure. And so I'm all for it. I think do it now when you have you're in your prime. Like, why do you want to wait till you're 60 and then get fresher eyes? Eyes tell a lot of the story.
You brought up Lindsay Lohan.
Yeah, I was about to say, can we talk about her?
There's been a proliferation of celebrities that, say that they, the Renee Zellweger, the Lindsay Lohan, although she named her dermatologist, I think is like in Dubai or something. And then you have Kris Jenner, who I think named her surgeon, who's in New York City. Who do you think celebrity-wise has had really great work done? And what do you think they did?
Oh, that's a good question. Well, Lindsay definitely is this super gorgeous, just inside and out as a human. I was so excited this year. I got to meet her at the Vanity Fair after party for the Oscars. And she was across the room. She's wearing this white gown and gorgeous emeralds. And I was just like, I have to go say hi. And I went and shook her hand. And then I said, I'm Dr. K. I'm in LA. And she's like, I know who you are. Watch your videos. So I was so excited. But in person, she looks fabulous because she's changed her life. She's had a baby. She's like cut out her glycemic foods, the alcohol, the drugs, everything. It's kind of this concept of integrative aesthetics, like looking good from the inside out. She's not had a facelift. She's had some beautiful collagen stimulation and probably some laser tightening. And to me, it looked like perhaps a bleph. But just the super subtle and gorgeous, like coming together of a woman who like got her life back in order and is taking great care of herself. So that was a really fun experience. And I think she's doing a beautiful job of it. And I think I love how a slightly older generation, I have seen a lot of actresses doing blephs actually. I think in the 50s age group, I love what J-Lo has done and Jennifer Aniston. And like, these are women who have done little minor adjustments and they've always done consistent good work. And they've maybe had some of their old filler dissolved, like we saw Jennifer Aniston go through some swelly phases, but now she looks like she's really got it all together. I think Martha Stewart is another example of such a good glow up and like age appropriate. I love it when people go subtle and own their identity and like don't try to be someone else. Kris Jenner, her work looks fabulous, but I also think she posted filtered pictures. I can't say anything negative about Kris. I love that she's transparent and her surgeon did a great job, but also like, she controls her image. Many things were filtered. She's in the swelling phase of the third lift. Things will settle down. And I think everybody looks stunning this year because Ozempic has given us facial definition and bone structure back, right? All the GLP shots that everyone's taken. When you lose 10 pounds, 20 pounds, you automatically start to look more angular and more young. And as long as you don't cross the line of everyone who's lost weight too quickly has developed mid-face fat loss, deep fat loss, and is looking aged. And I have a really amazing treatment for that too, to prevent Ozempic face.
Oh. Yeah. What is that?
Because I feel like a lot of people are on the Ozempic wagon and are losing weight. Sometimes the first thing you notice is that their face here in the middle looks like kind of hollow and saggy.
They get all gaunt and like gaunt looks elderly a little bit.
It makes them look more elderly. Yeah,
it's pretty profound. Anyone who's lost 30 pounds within like 3 or 4 or 5 months is going to get that kind of rapid facial loss. So there've been some studies done that show that on MRI, they lose up to 10% of their facial fat. Like imagine 10% is quite a lot. So I have a treatment that we start at the beginning of the Ozempic journey, and then we will do a session every 10 pounds. And it's my own technique for building mid-face collagen and support. It's kind of like a fishnet effect. So I'm injecting collagen stimulators at 3 different levels, right on the bone structure at the ligament. So we tighten up the ligaments, and then we're injecting the mid-face fat pads, and then also in the skin, because you do lose dermal white fat and it thins the actual dermis. So we're boosting all 3 layers of where Ozempic can change you. And then I'm publishing a paper in Aesthetic Surgery Journals coming out this month with my results that show proof of concept that this does prevent Ozempic face. So we tracked patients while they lost 30 pounds and their faces didn't change.
Oh, I love that.
Yeah.
That's amazing. Congrats on your publication.
Yes, congrats. I love that you still find time to do academic work despite having a busy private practice and your own skincare line and all of these things that you're juggling. So that is quite impressive, Dr. K.
Well, thank you. I'm all for it. I think we need to bring an objective eye to what we're asking patients to do because they're spending a lot of money. And sometimes it's just because some trendy injector said, do this. And I tried it on my 3 patients and it worked. And I'm like, that is not scientific. I want people to see that it's studied and proven and like makes our industry better.
I love that you also focus on facial balancing. You alluded to this a little earlier, how people come in and they want one specific thing. Like they're like, oh, I just want to focus on making my lips this certain size, or I just want my cheeks to be like this certain way, without really taking into account their whole facial structure and that maybe those lips on their face don't match. What advice do you have for someone that's looking at things piecemeal when it comes to their face?
I think facial optimization is one of the most popular things I do. And I honestly love it when a patient just says, well, I don't know what I want, but can you look at my face and tell me what I need? Because then I can use my training, my expertise to kind of look at facial proportions, see what are their best features. I want those to pop. I think I do a good job of not trying to stereotype beauty into like what's Caucasian, Western, or like it has to be very identity specific. And so I think that's a really important thing is to look at the upper, middle, and lower third of the face and figure out where are the strengths and weaknesses of the face. And like when people trust that process, it's like the summer I became pretty. It's like
I am enjoying that show.
It's just gradual evolution of you are who you are, but we just got that elevated, like bringing out all your best features. It's a fun journey to do. And a lot of people still just want that one feature and they think that's the reset, but I always build a little beauty plan into their consult. Like, okay, here's the one fun thing you wanted, but I'm going to talk now about the foundation building, the long-term change, like the beauty plan for the next couple of years. Like I want that for myself. I want someone to like look at me and tell me because we see ourselves different in the mirror than other people see us.
Yeah. And I think in general, having had this conversation with you for our listeners, I just want to bring up the fact that like, you don't need any of this stuff, right? Like we're trying to like approach the asymptote of perfection. But the reality is that I have friends that have never gotten Botox or filler, like barely wash their face and wear sunscreen. And I think they're all beautiful women. And so I think there's this like cultural push for women to try to preserve their youth. I walk down the aisle at Target and everything says like anti-aging and all this stuff, but I think there is something to be said, for aging with grace. I plan to still get my Botox Dysport. I've never gotten filler, but I think like I would be open to it, especially now that I'm in my 40s and I think I might have an actual need for it. And I love microneedling. I haven't done it all summer because you need to be out of the sun for like a week or so. And there's been no week that I'm not going to be in the sun a little bit. But what would you say for people who maybe have a limited budget or they're just a little shy to all this? What treatments would be like the most bang for their buck if they only had a certain limited amount of resources?
I think definitely doing a little tox is something that it's kind of a home run, right? And the cost wise, it's like $200 to $400, depending on which area. Maybe if you're doing your full face, might run around $700-800. And I think that's a result that's beautiful and gives you confidence, lifts heaviness and tiredness, and you'll see it's like you went on vacation, that kind of a freshness. So that's a nice, simple thing to do. Microneedling, I think, is another great one that's less expensive. And I want all people to think about doing that. And even just doing one session of collagen stimulator, like you don't have to do a lot, But if you at least like every 6 months do something for your aging process, you're going to have better. I think we have to maintain, like you're going to have a better foundation for long term. I want all women to know that if they do they have to do the maintenance. Actually, if you can't live to be 80 and 90 years old, and women are going to live to be 80 and 90 years old. And if you don't do the maintenance, like you can't drive your car for 80 years and not put service into it. You have to do these things that refresh and give a new coat of paint and change the tires. And like, you got to do the internal, maintenance in order to feel good about yourself. And this is our biggest asset. This is your Ferrari. You've got to maintain it.
Yes, I'm excited for all the new stuff that's coming out. Thank you so much for joining us and sharing your wisdom with us. Tell our listeners where they can find you.
Of course. Well, Beauty by Dr. K, DRKAY is my Instagram and all my social handles on TikTok and everywhere. And our website is the same as beautybydrk.com. Would love it if you come visit.
I want to come.
Yeah, you girls should definitely come.
I would like to make an appointment.
Stimulators.
Yeah. Sign me up.
Yeah, fortunately, you're both flawless.
I may not be into it just yet, but I'm like, no, stimulate me.
Yeah, I think that's something that's invisible. It's working under the surface, and like it really just builds your future foundation. So it's my new favorite thing to do. But you girls are stunning. Don't need a thing.
Well, thank you for sharing with us, Dr. K. It was lovely to have you on. You have a wonderful day.
Thanks so much. Bye, ladies. Mwah. Stay beautiful.